Namaskar. I'm Dr. Abhijit Joshi, a consultant in orthopedics and specialize in trauma, arthroplasty, and diabetic foot. Today, I'm going to talk on a topic that is useful in preventing a complication that can usually occur post-operatively, and the patient's caregivers, relatives can play a major role in preventing this complication. The complication that I'm talking about is called aspiration syndrome, and it can occur more commonly after a patient has undergone major surgery or has decreased mentation, that is mental alertness. In aspiration syndrome, what basically happens is that the food particle or bolus of food, as you can see in this picture, or liquid that has been ingested by the patient goes involuntarily and accidentally into the respiratory tract. And this process can cause an acute breathing problem. As we can see in this drawing, the air that we breathe in through the nose goes down the windpipe and into the lungs. And the food that we eat through the mouth goes through the food pipe, or as it is technically called, the esophagus, into the stomach. Just above the windpipe, there is a structure named as the epiglottis, which acts like a gate and it prevents the food from going accidentally into the windpipe. Now, due to many causes, the food that has been ingested gets into the windpipe and can further go down into the lungs, causing a severe lung function compromise. And when this happens, it is called as an aspiration syndrome. This process is sometimes akin to internal vomiting, where instead of the vomitus being thrown out through the mouth, it accidentally goes into the windpipe. Now, once the food or water contents of the stomach go into the trachea or windpipe, there are two things that can occur, and they are aspiration pneumonitis and or aspiration pneumonia. Now, in aspiration pneumonitis, a chemical injury happens on the windpipe because of the acidic gastric contents. And in aspiration pneumonia, there is an infection of the windpipe and or the lung tissue because the aspirate is colonized with bacteria. Now, because of the gastric contents in the lung tissue, the lung is unable to perform its function of oxygenating the blood, and the patient starts to suffocate and has difficulty in breathing. In aspiration syndrome, the cough reflex is blunted or reduced. The cough reflex being a normal person, say, laughs or talks while eating, and a small particle of food accidentally goes into the windpipe. Immediately there is an automatic cough reaction, and the person will violently cough to throw out that small food particle out of the windpipe. This is the cough reflex. This cough reflex is prone not to happen in certain cases or risk factors. Now, what are the risk factors that are associated with aspiration syndrome? The main and the most important being decreased level of consciousness or alertness or being sleepy. Secondarily, it can be because of increased severity of the illness, wherein the patient accidentally aspirates into the lung because of decreased mentation or consciousness. It can also occur after general anesthesia, and if the food or water is given to the patient before he is fully awake, and in such circumstances, the patient may accidentally aspirate. It can occur more frequently in patients who are more than 70 years of age. Not that a patient below 70 years of age is immune to it. And also in those people having a pre-existing lung disease like COPD, chronic smokers. So how do we now diagnose aspiration syndrome? Basically, at the initial stage, there is an attempt at violent coughing as the patient tries to dislodge the food items from the windpipe. There can be fever, there can be dyspnea and wheezing. dyspnea being difficulty in breathing, and wheezing being breathing with a whistling or rattling sound that is loud enough to be heard. The awake patient starts being drowsy, starts becoming unresponsive. There is also a drop in SpO2, that is the concentration of oxygen saturation in the blood. Of course, this can be because of some other reason also, but for today's talk, we are assuming that this is because of aspiration syndrome. After an initial presumptive diagnosis has been made of aspiration syndrome, certain investigations are done, like a chest X-ray and blood gases. In this example of a chest X-ray, the one on your left being taken before an aspirate has occurred, and the one on the right being after aspiration. You can see these white opacities, which is food and water into the lungs, and the patient has gone into aspiration pneumonia. So we come to the treatment of it. The treatment of aspiration syndrome involves having a very high index of suspicion that aspiration syndrome has occurred. And once this has been confirmed and after other causes have been ruled out, then usually a bronchoscopic lavage is done to clean the lung and windpipe of the food contents. That is, a small telescope is inserted in the windpipe and all the food contents are evacuated. Antibiotics are given. Antibiotics are given to control infection. Sometimes an ICU and ventilator is also required if the patient has become dyspneic or is unconscious. In a few cases, this aspiration can result in a fatality. So the best option is to prevent it. And it can be easily done by having adequate knowledge about this syndrome and having a very high index of suspicion that the patient has gone into an aspiration syndrome. Now we come to the most important part of how we can try our best to prevent this from happening. This is very important. Prevention is better than cure. Before giving food or water to the patient, keep the patient upright for about 5 to 10 minutes, provided the patient has permission from the doctors to sit upright. Give the patient food or liquids in small quantities and slowly over 2 or 3 minutes. The patient should have occasional sips of water through a straw while he is having food. The food should be consumed over 15 to 20 minutes, and now comes the most important part. After having consumed his meal, the patient should be made to sit upright by the clock for 20 to 30 minutes. And I mean by the clock. The longer he sits upright, the better. By making the patient sit upright for 20 to 30 minutes, it gives the body time to push the food from the stomach downwards into the intestines. After about 30 minutes, the patient can be made supine or lie flat back in slow increments. As you can see from the picture, so from 90 degrees, over 5 to 7 minutes, make it 45 degrees. So his patient is upright, in 5 to 7, make it 45 degrees. Then again over 5 to 7 minutes, make it 30 degrees till the patient is made flat. This does not mean that the patient will never have aspiration, but we have done all that we can to prevent it. Another small tip is that before giving food to the patient, inform the caregivers or hospital staff that you are starting to feed the patient and note the time. And once the patient has finished his meal, again inform hospital staff or caregiver that the patient has finished his meal and he is being kept upright for 30 minutes. Kindly ask the patient's relatives and caregivers to have a look at this video, and especially to relatives who come visiting the patient and offer food out of goodwill and affection. This complication can be avoided if adequate precautions are taken and the relatives are made aware of this and follow the process as described in the previous slides. Kindly like the video and subscribe to the channel. Best wishes and regards. Jai Hind, Jai Maharashtra.